Vaginal dryness can be a huge issue for women. It can disrupt everyday life, it's uncomfortable, it can be painful, and it can make things like having sex impossible. It's really common around the time of perimenopause, menopause, and postmenopausally, but it can affect women at other times in their life as well, especially after having a baby or if a woman has a hormonal disorder. But there are things that people can do to help alleviate the symptoms. So here are my 3 top tips. Tip number 1 is using vaginal lubricants or moisturisers. But it's important to know that you need to use these regularly, and it can take several months to get the full benefit. If you try one and it's not working for you, have a chat with your pharmacist because there are many out there. My second tip is to consider HRT, especially if this is an issue linked to perimenopause or menopause. So typical HRT, we tend to think about the tablets, the patches, the gels, but especially for vaginal dryness, there is the option of using topical HRT. So that's estrogen creams or pessaries that are inserted onto the vulva or into the vagina. And these can really help with vaginal dryness. The additional benefits of these is that they don't have all of the risks associated with other types of HRT, and some forms you can actually buy over the counter. And my third tip is to talk about it. Talk to your friends, talk to your partner, talk to your pharmacist, and talk to your GP. And whatever it is you're experiencing, sometimes talking about it can really help. If, for example, you're really struggling when it comes to having sex, there are many different ways to explore having a sexual relationship that isn't necessarily always penetrative sex. If your issues are around urinary symptoms such as urgency or frequency or recurrent UTIs, have a chat with your GP because there are lots of lifestyle measures, as well as the things we've already discussed, that can be helpful. And I think, don't forget that this is a really common problem. It affects so many women. Don't be embarrassed about it. Talk about it, and there are things out there that can help.